We are excited to introduce Dr. Aaron Boster, president of the Boster Center in Columbus, Ohio. Dr. Boster is a neurologist specializing in multiple sclerosis and related central nervous system inflammatory disorders. At 12 years old, after watching his uncle suffer from MS, before treatment was available, he decided to become an MS specialist. Thank you. He earned his MD at the University of Cincinnati and completed an internship in internal medicine and residency in neurology at the University of Michigan. He has been a principal investigator in numerous clinical trials, trained multiple MS doctors and nurse practitioners, and has been published extensively in medical journals. He is a worldwide lecturer and maintains an educational YouTube channel with over 36,000 subscribers. Plus one, I'm going to add myself. He lives in Columbus, Ohio with his son, Max. Please welcome Dr. Aaron Boster, virtually, as he joins us from Ohio, and he's speaking about cannabis for MS.
Howdy. Can folks hear me? I just want to make sure that you can hear my presentation. All right, I'm getting a thumbs up. I can't see you, but you can see me. And I want to start by saying thank you to Mindy for the warm invitation. I am absolutely delighted for the opportunity to speak to everyone. Yoga Moves MS is an amazing organization, and they really have their fingers on the pulse of where the field is going. And where it's going is realizing that it's a fool who thinks that he can help a complex neuroimmunologic condition with a pill or a shot. It takes a village to live your best life despite having MS. And today I'm going to share with you an adventure that I went on that led to me becoming a medical marijuana recommender in the state of Ohio. So it starts back when I was a little kid and Nancy Reagan said, just say no to drugs. And I grew up in a household where drugs were bad. And we fast forward through college and med school and residency and fellowship. And I'm working in Ohio as an MS neurologist. And the state of Ohio passed a law which made medical cannabis legal. And one of the indications was MS. And so I did my due diligence. I looked to the medical literature and I studied diligently, and I was completely devastated by the lack of information. There was a profound paucity of information supporting the use of cannabis. And I thought to myself, this is not for me. There isn't enough evidence to support doing this. I'm just going to not participate. And I didn't. Then something very, very interesting happened. A very dear patient of mine, a woman who's in her mid-70s, came in to see me unaccompanied. And when we were talking during the course of her visit, I said, hey, how are you doing with your sleep? Is the Lyrica helping? And she said, I'm not taking the Lyrica. I said, what do you mean you're not taking the Lyrica? She said, well, my grandson gave me a doobie, and if I puff on it before bed, I don't need the Lyrica. My feet don't hurt. Now, this is a gal that goes to church. She doesn't drink alcohol. She's a really wonderful citizen. And here she had discovered something which I didn't know what to do with. So I just put it away. And it wasn't a week later that another gal in her late 60s who didn't know the first person told me darn near the exact same story. She said, hey, listen, I stopped taking your baclofen. If I do a THC edible, she tells me, then I don't need it. I can do that instead. And over the subsequent months, I kept hearing from gals who are 60 and 70 who didn't know each other, and they were all telling me the exact same thing, that using cannabis was helping some of their MS symptoms. So I decided that either A, there was a sewing circle that thought they would play a joke on Dr. Boster, let's all tell him the same lie, or they had discovered something that was helping them lead a better life. And so I decided that was enough. It was enough that my patients were consistently reporting benefits that I needed to revisit cannabis. I needed to revisit the information, and I needed to see if I could make sense of it. And so I went back to the literature, and guess what? There wasn't really much more to share. And yet, going based on my patient's experience, I went ahead and became a medical marijuana recommender. And that was several years ago. And I'll share with you today, cannabis is a major tool to help many, many MS symptoms. And so I want to spend a few minutes with you today talking a little bit about the science of cannabis and where we have found applications in the MS Center to help patients' symptoms. So first of all, if we're going to talk about cannabis, we need to talk about the endocannabinoid system. Now, I did not make that word up. The endocannabinoid system is one of the many systems in your body, like the cardiovascular system or the nervous system or the immune system. So the endocannabinoid system is a series of receptors set up all throughout your body. And when those receptors are stimulated, they modulate or they tweak other systems. So the endocannabinoid system can tweak your inflammatory response. It can tweak appetite. It can tweak metabolism. It can tweak pain. And so it's a very interesting system. And this is set up in the human body. And the human body makes a chemical called an endocannabinoid. So you actually make these molecules, these cannabinoid molecules, which bind to your endocannabinoid system. That's really neat. Now, some of you may have heard of this plant called cannabis or ganja or weed. And cannabis is this really fascinating plant. And when cannabis grows, it produces hundreds of cannabinoid chemicals. So these are molecules called cannabinoids. They're not endocannabinoids because they're not made inside our body. They're phytocannabinoids because they're made in a plant. So, of course, we have to use some silly words. So the cannabis plant makes these phytocannabinoids. And some of them are so similar to our endocannabinoids that if we ingest cannabis, the chemicals in the cannabis plant bind to our endocannabinoid system. So we can actually trigger or stimulate the endocannabinoid system by using cannabis products. Now, as I mentioned, there are hundreds and hundreds of phytocannabinoids. The two most common, and the ones that I wanted to speak about with you today, are THC and CBD. So when you look at a cannabis product, it's very likely going to have either both of those in it or one of the two. And those are the ones that are found in the highest concentration in naturally growing cannabis. And let's start talking about THC. So THC is the most dominant cannabinoid in cannabis, and it binds beautifully to the endocannabinoid system. And in specific, it binds to a type of receptor called the CB1 receptor. Okay, so it's called CB1. And CB1 receptors are located throughout the body, including the supercomputer, the brain, all right? And so when you use cannabis and you ingest THC, it will bind to these CB1 receptors, and it can cause you to be medicated. Back when I was in high school, we had a different term for it. We called it getting high. And so now oftentimes we'll talk about the risk of being medicated because THC can have a psychoactive effect. There's a second cannabinoid called CBD, which is also in very high concentrations in the cannabis plant. And CBD does not bind to CB1 receptors. It binds to CB2 receptors. And CBD does not bind in the brain the way that cannabis does. And what's very interesting is, unlike THC, CBD has no psychoactive effects. So you could take CBD and then you could take a math test or drive a car or what have you, because it wouldn't impair you. Now, let's talk about what this THC and CBD can do for us as it relates to multiple sclerosis. If you turn to the medical literature, you will be disappointed bluntly. The reason that you'll be disappointed is because we don't have a lot of research studying cannabis and there's a couple of reasons why. If I rolled a blunt and I lit it on fire and I sucked on it really hard, and then I gave it to you and you took a little puff, we both ingested cannabis, but I ingested a lot more than you. And as you can imagine, when you're doing clinical research, you need to have a metered dose. It needs to be a specific dose because you don't want someone to have a whole bunch and someone to have not very much. There's many other reasons all along the same lines that make it terribly difficult for us to study the effects of THC and CBD in a traditional medical sense. Now, the very best research that's come out is for a product that is not approved in the United States. It is approved in Canada, just north of us. And it's called Sativex. and it is an extract of CBD and THC, and it's used in an inhaler, kind of like if you have asthma and you have an asthma inhaler. And the Sativex was studied in multiple sclerosis, specifically with spasticity. And what they found was really lovely. They were able to show in multiple sclerosis that it could help with spasticity. And transparently, that's probably the very, very best data that we have. So I can't answer you with lots of scientific information about the evidence supporting THC for this and CBD for that. So instead, I'm going to share with you what I've been doing in clinic for the past 2.5 years, helping people improve the quality of their life using these products. So I have found probably 4 or 5 different areas in MS symptomatology where I think cannabis really can help a lot. The first one is insomnia. Now, let's be honest. Many, many people impacted by MS are bad sleepers, as my grandma would say. They're not good sleepers. And there's lots of reasons why people impacted by MS can suffer from insomnia. Pain, spasticity, bladder feeling full. There's a host of reasons that someone with MS has trouble falling asleep and trouble staying asleep. Now, there are a bunch of behavioral measures that I use in clinic. Meditation is one of them. Changing the bedroom, making it dark, making it cold. There's a host of things that one can do behaviorally to help facilitate sleep. But oftentimes, by itself, that's not enough. And sometimes patients will ask for medicines to help them fall asleep. And there are a bunch of sleep aids out there. And I, as a neurologist, can't stand them because they're laden with side effects. And so I have found that using either THC and CBD or just CBD by itself has been remarkable in its ability to help people with insomnia. I'm going to get into the types, the different routes of cannabis ingestion here in a little bit. But while we're talking about insomnia, I typically will have patients take 1 to 4 10 milligram THC gummies at bedtime. We titrate that. We don't just start off taking a bunch. And what I have found time and time again is I can get restorative sleep for my patient and they wake up and they don't feel impaired, which is really fantastic because if you have insomnia and don't get restorative sleep, all of your other neurological symptoms start to rear their ugly head, and it can become a very, very serious problem. And so one of the areas that I've had great success in using both THC and CBD combined, or just CBD, is with insomnia. Another area where I've had great success in using cannabis is treating anxiety. So many people impacted by MS suffer from anxiety. In fact, people impacted by MS are twice as likely to experience anxiety compared to the general population. And anxiety can present in 2 ways. It can be this underlining nasty sort of pit of your stomach sensation, which is kind of chronic, or you can have a frank panic attack or an anxiety attack. And both are god awful. And both are unfortunately very common in the setting of MS. Now, we can put people on medicines like antidepressant, anti-anxiety medicines, and they can take those medicines on the daily. And many times that can help someone with anxiety at a cost. There's lots of side effects. And sometimes people still have breakthrough panic attacks. And so in that case, in allopathic medicine, we reach for medicines to break the panic attack. But depending on the medicine, it can make the person, completely zonked, or it can make the person loopy, or it can make them fall asleep. And that's not going to be a great option if they're having a panic attack at work. Now, I have had great success in using CBD. I shared with you earlier that CBD has no psychoactive properties, and so it doesn't cloud the sensorium. And taking a CBD tincture or a CBD gummy has been remarkable to help patients break the anxiety path. And that's been really super. So in addition to insomnia, I've had a really good success in using specifically CBD to help with anxiety. So where else have I found value in using cannabinoids? So one huge area of my practice is dealing with spasticity. So spasticity, as you're probably aware, is when your muscles fight with one another. So if I want to bring this glass of water to my mouth, my massive bicep has to contract and my massive tricep has to relax. And in the setting of MS, because of damage to the spinal cord and brain, this information kind of gets lost. And so when my arm's trying to do this, it's also trying to do that at the same time. And I have a tug of war with my own arm or my own leg. Spasticity is very common in the setting of MS. I would submit that upwards of 70% of people with MS have spasticity. And it typically presents as spasms, like a shaking of a leg or an arm, or a cramp like a Charlie horse, which can, drop you to the ground in pain, or a stiff arm or leg that's hard to bend. And not uncommonly, this can wake you from sleep, or it can really interfere with the quality of your life for a multitude of reasons. I think that using THC or THC and CBD in combination is an outstanding way of dealing with spasticity. And in a second, I'm going to talk about different ways of ingesting cannabis, and I'm going to come back to the spasticity example because different cannabis products help with different kinds of spasticity. Similarly, I have had outstanding success in treating neuropathic pain, which is unfortunately also very common in MS, with cannabinoids. I have had success using a CBD cream, no THC in it, just CBD, and we apply it topically. And I wouldn't say that it works in all people with neuropathic pain, but it seems like well over half of the patients tell us that they have a really robust response. I have also had success in using THC and CBD gummies to help with neuropathic pain as well. So in quick summary, insomnia, anxiety, spasticity, and neuropathic pain are outstanding, in my experience, responders to cannabinoids. There's one other really interesting area that I want to share with you where I have found value in cannabis, and it's not in an area that I would have expected. I was talking to a very dear patient of mine, and we were discussing the success he's had using cannabis to help with various neurological symptoms. And he said, the biggest benefit, Dr. B, is dealing with difficult or irritable situations. And I didn't understand what he meant. I thought he meant maybe when he was feeling irritable, the cannabis calmed him down. He said, no, that's not what I mean. He said, I'll give you an example. So this guy has a Peloton bike and he loves riding his Peloton bike and he'll bike for hours, but he's developed burning in his leg when his body heats up. And so he would have burning in his left leg who is on the bike, and it will cause him to stop exercising. So he did an experiment and he used cannabis before exercise. And what he said was amazing. He said, my legs still burn, but I didn't care. I was able to keep going. It still burned, but it didn't bother me. And so now he very successfully will exercise for several hours only after he's used cannabis. Now, as we start to wrap up our discussion, I want to talk about different routes of administration because there's lots of different ways that one can ingest cannabis. And I do not recommend taking cannabis leaves and lighting them on fire and then sucking in the smoke. Because sucking in a carbon-based smoke is super duper pro-inflammatory. It's pro-inflammatory to your lungs, but it's also pro-inflammatory to your blood vessels and to your brain. And in the same way that I don't want my patients to smoke tobacco because that can speed up MS, I also really don't want them to smoke cannabis. Now, I give this talk virtually in the great state of Michigan, a state that is very dear to me. And your laws are a little bit different than where I'm practicing just south of you in Ohio. Now, in Ohio, we don't have a recreational cannabis law. And so cannabis is available for qualifying diagnoses with a cannabis card. And MS is one of the 13-some diagnoses. And so, I just forgot my point. Maybe if I have a sip of water, it'll come back. In the state of Ohio, smoking cannabis is actually still illegal. And so they've legalized medical cannabis use, but not smoking. So what are some really helpful ways that we can ingest cannabis? We first have to think about the speed of the symptom that we're dealing with. So if you're having a panic attack, you need treated right now. If you're having a spasm of your leg, you need treated right now. And so you wouldn't want to take an edible if you were dealing with an acute symptom. If you're dealing with an acute symptom, you need something that's going to act fast. And I just told you that I didn't want you to smoke a joint. So we need something else. And this is where a vape pen comes into play. So if I had a pen, I would hold it up as an example. A vape pen looks like a pen, like a Bic pen, but inside of it, it has a concentrate of liquid cannabis, oftentimes both THC and CBD. And when you suck on the pen, it heats up the liquid below the level of combustion. So there's no burning, there's no smoke, but there's vapor. And then you breathe in the vapor. And the onset of a vape pen is almost as fast as smoking a joint. It's very, very quick in a couple of minutes. And so you can imagine if you were woken from sleep with a spasm of your leg and you got a cramp and it really hurts, you could grab the vape pen, many of my patients do, and use the vape pen, and then it would calm down the spasm. Similarly, if you're woken with neuropathic pain and it hurts real bad right now, then we're going to use something that's fast like a vape pen. Now, on the other side of things, there are certain types of symptoms that we want to control in a chronic fashion. We're not looking to deal with it right away. We're looking to deal with it for hours at a time, like difficulty with sleeping. And so difficulty with sleeping, or say, if you were having baseline anxiety throughout the course of the day, not anxiety attacks, but just baseline anxiety. For those kind of situations, I don't think that a vape pen is the answer, because you would need to redose way too often. And so in that case, we use a different technique. We use an oral agent, an edible. And so in Ohio, almost every edible has 10 milligrams of THC. And I ask patients to purchase a tin and cut it in half and start with 5 to see how they respond. And the gummy doesn't kick in very quickly. On the contrary, it can take about 45 minutes to kick in. And it may peak somewhere between 1 to 2 hours, and then it may last for several hours. And so I have the patient write down, when did they first notice that it kicked in? When did it peak? When did it go away? What were the benefits and what were the side effects? And once we have all that written down, I can help them use the edible like a pill, like a baclofen pill, where they might take half of a gummy 3 times a day or something of this ilk. Now, the gummy edible on one end and the vape pen on the other end are extremes. And there's actually an option in the middle, which I think is not utilized enough. And that's tincture. So a tincture is an old apothecary term. It's like a eyedropper, like a glass eyedropper full of liquid. And inside of it is a little, bulb syringe, and you drop some medicine, and then you can drop it under your tongue. So under your tongue, there are giant blood vessels, and very quickly, about 25% of the liquid is absorbed into the large blood vessels, and it's going to kick in within several minutes, almost as fast as a vape pen. Then you're going to swallow the rest of it, and it's going to go in the stomach, and it's going to be absorbed and go through first pass in the liver, and it's going to kick in about 45 minutes, just like an edible. So if you imagine the onset of action, vape pen is fast on, fast off. An edible is slow on and very slow off. And tincture kind of has a quick onset and then a slow decline. And so keeping that in mind kind of helps us figuring out which is the best application. Now, if I could give you one piece of advice, it's to take notes, because your experience with cannabis might be very unique to you. And your girlfriend who tells you that something worked for something might help you, or it might not. And so I would strongly recommend that you keep a notebook, and so you can write down what you do. I also strongly recommend, particularly when you're first starting to use cannabis, to only do one thing a day. So if you take a 10 milligram gummy, and this is the first time you've done that, and you're not sure how it's going to work, I would not encourage you to take any more that day. And I want you to avoid the trap of the 20-year-old boy. So a 20-year-old boy has trouble waiting. And so he may take a 10 milligram gummy, and in 5 minutes, he doesn't feel anything. So then he takes another 10 milligram gummy. And then in 10 minutes, he doesn't feel anything. And he takes one more. And he ends up in the ER that night because he has a really, really bad day. And so I certainly want you to pay attention to the pharmacology so that you don't fall into that trap. Now, before I wrap up, I do want to talk about some of the side effects and risks of cannabis, because I would not be doing it justice if I didn't talk about that. And so the cannabis product is nowhere near as dangerous as I think Nancy Reagan made it sound like back in the ancient days of yesteryear, with just say no. But there are some side effects that I think are important to consider, right? Number one, we have to worry about an amotivational syndrome. People with MS can have difficulties with energy, and they can have difficulties with fatigue. And sometimes excessive cannabis use can result in an I don't care attitude. And coupled with decreased energy, that's a space that I don't want my patient to enter into. Now, fortunately, I don't see this very often at all, particularly not when you're using cannabis to treat specific symptoms. but it is something that's out there, and I just want to sensitize you to it. The second thing I want to say is that many patients can develop somewhat of a dependence to cannabis. Just like you can develop a dependence to Adderall or a dependence to a benzodiazepine like Valium, it is true that if you use cannabis regularly, you may have some difficulties when stopping, just like many, many medicines. And so I just want to make you aware of that. And lastly, I'll share with you a very rare side effect that I've seen twice, and it's a hyperemesis syndrome, where someone who uses cannabis a whole bunch starts having a weird situation in the mornings where they feel nauseated, but they can still eat. And then they start throwing up, and they throw up for a long time unless they get in a hot shower, and then it stops. And when they come out of the shower, it'll start again. Now, this is very, very rare. I've seen it twice, as I mentioned, and both times stopping the cannabis and giving a couple weeks solved that problem. My name is Aaron Boster, and as always, thank you for learning about MS with me. And specifically, thank you for letting me talk to you about my journey to become a medical marijuana recommender. I feel that medical cannabis is a tool to help improve the quality of people's lives. It doesn't slow down MS, and it doesn't treat everything there is to treat, but I am delighted that I listened to my patients. I am delighted that I looked beyond the pale of the medical literature so that I could try to help people in Central Ohio live their best life. Now, I'm going to turn to the questions. Thank you for the hearts. I see the hearts coming up, and that warms my heart. Thank you very much. And I see some questions. So unless our hosts have a different idea, I'm going to read some of the questions and then provide my answers. And you guys are amazing. Thank you for those wonderful hearts. So the first question comes from Kevin E. And he's also remote. So I'm remote and he's remote. Hey, Kevin. And he writes, am I wrong, or has the endocannabinoid system, the ECS, really only been identified, discovered, and studied in the past 15 years? No, you're not wrong. So it was only recently that we discovered that we have this endocannabinoid system in the body. Now, I'm going to date myself, but I've been out of med school a lot longer than 15 years, and I certainly did not learn about any of this when I was in school. That's a great question. Now, there's an anonymous attendee who writes, how can I get medical marijuana if it's not legal in our state? And I don't know of a way that you can do it legally. Now, I want to bring up an important point. The state of Michigan has legalized medical cannabis. Ohio, which is one state below Michigan, has made medical cannabis available. So I'm sorry, recreational cannabis in Michigan and medical cannabis in Ohio. But the federal government still views cannabis as a Schedule I substance. And if you were to travel across state lines with cannabis, that's a federal offense. And so don't do that. At present, there isn't a way that we can get you medical THC cannabis if it's not legal. I would encourage you to look into the state laws regarding pure CBD, because many states pure CBD is available and it's not controlled in the same manner. That was a great question. Thank you. So Michelle says, can you spell the inhaler product Dr. Boster mentioned? So I don't know if I can. Sativex. Yeah. So Sativex. So Sativex, Sativex. And that's not available in the United States, but it is approved in Canada. Alyssa writes, I hesitate to take cannabis because I'm afraid it will affect my balance. I already have trouble with my balance, and that is an outstanding point. And so the experiment, if you would be to try it in a safe environment and see if it hurts your balance. And if it does, as you're concerned, don't do it anymore. I really like this question because it brings up the reality that cannabis is not magic and cannabis can cause problems. And so we want to be sensitive to that, just like we would with any other medicine that we might use to help us. So Kathy Chester wrote in. Kathy is a wonderful gal that I interact with sometimes on the interwebs, on Twitter. So Kathy, great to see you. I'm told by a functional medicine MS doctor that I shouldn't use CBD because of my issues with constant kidney stones. Can Dr. Boster comment on that? And that's a really important point. So CBD can increase calcium. There is a small risk of kidney stones. And so you want to be forthcoming, in my opinion, with your doctor about what you're doing so that they can factor in all those things. Do I think that it's an absolute no? I wouldn't say that, Kathy. I still think that it might be worthwhile trying, but we're going to have to go low and slow. We're going to have to use the lowest dose possible. We're going to have to do a heck of a good job hydrating And it's not a guarantee that we won't get ourselves into a sticky wicket. But I don't think that it's a guaranteed conclusion. I have used CBD in patients that have kidney stones without difficulties. So April writes, what if we can't?
Mindy.
Howdy.
Oh, hello. We have a question here. In person, what would you recommend to help fatigue and lethargy?
So I think we have to be very careful using cannabis to help with fatigue, because sometimes cannabis makes us feel relaxed. I have heard non-medical people say that certain strains of cannabis are more uplifting, and the science doesn't support that. Again, I think it's really important that you keep careful notes. If you go to a dispensary and make a purchase, you need to write down the effect. Although I personally would not turn to cannabis to help with energy or lethargy, I would probably turn to a different therapy for that specific symptom.
Thank you. Can you explain the pen use one more time?
Sure. So if you take like a liquid or this piece of paper and you light it on fire, it'll heat up to the point where it burns. That's called combustion. And when a carbon-based something burns, it makes smoke. So if you light a cigarette, you're lighting tobacco on fire, and then it's making smoke and you're sucking that into your lungs. So if you have a rolled joint of cannabis and you light it on fire and it's making smoke and you're sucking in the smoke. The problem that I have with that is it's very pro-inflammatory. It can really cause a lot of inflammation, not just in your lungs, but also the blood vessels, the brain. And so that's not so good when we're trying to quell inflammation in the body. So there's another tool called a vape pen, vape like vapor. And vape, oh, there's one. I think there's an example of what a vape pen might look like on the stage right now. And so it literally
just happens to have it on hand.
Yeah. And so we might even get an example. Now, if you look at that cloud of vapor, that's not smoke. That's vapor. So can we give her a round of applause for demonstrating to us? And so a vape pen is something that you can carry in your pocket. It's discreet. It typically doesn't smell the same way that cannabis it smells if you light it. And it works very, very quickly. Now, when she pulls on that pen, when she sucks on it, it heats up the liquid cannabis inside below the level of burning. So it doesn't set it on fire, but it heats it up enough that the liquid turns into a vapor. It vaporizes, and then you can breathe in the vapor. And the thought is that that's less pro-inflammatory than breathing in smoke. Great question. Thank you. And thank you for the assistance with the example.
Okay. Yeah, that was awesome. Thank you. One more question. No one seems to talk about the exaggerated startle response in people with MS, but I know many struggle with it. Does cannabis help with that?
So I like this question because individual human beings have a host of individual symptoms that really bother them. And whereas I don't think there's one size fits all, we could answer that question by trying it. So you're right. The startle response can be really, really off-putting, and it can really be jarring. And so the experiment would be to try an edible cannabis product like a THC gummy, and then to have a family member sneak up on you and see if you have the same response or whether it's blunted. And that might be a really fun experiment to figure out.
Thank you, Dr. Boster. We so appreciate that you came on with us live today.
Thank you very much for having me, Mindy. This is a wonderful program. I'm so glad that I got to participate. And I hope that you guys are ready with your pens and papers and listening, because the lectures that are coming are really, really dynamic.
Namaste.